A lot of times patients will want to know what are the risks and possible complications after bariatric surgery, and that's a very important question to ask. And it's a little different for each operation. The gastric bypass is the more complicated operation, more complex, so it has a slightly higher risk. Things that are common are things like bleeding, which is very, very low, less than 1%. Infection, again, around 1%. But since we're basically replumbing on a gastric bypass, the thing you worry about the most when you have plumbing done is leaking. It happens very low, less than 1%, probably about 0.08%. With the sleeve gastrectomy, we're not doing the bypass part, so there's a little less risk in terms of leaking, but you still can have a leak from the staple line of the new banana we've created after taking out part of the stomach. Again, it's very low. The key is knowing what you're doing, not making it too tight, and making sure that those staple lines are sealed at the end of the surgery, which we all do. Again, there's a small risk of bleeding, a small risk of infection, but the risks, when you compare them to the health issues, are very low, and it's not worth not doing the surgery. And in fact, if you take the same patient who needs a total hip replacement and a gastric bypass and you do those operations, the patient with the total hip has the higher risk than does the patient with the gastric bypass. There are things that can happen after surgery, or that things that can be anticipated after surgery that patients want to be aware of, and one is reflux. Every patient who has any type of weight loss surgery, we want them on a PPI or something to control acid reflux for at least a year after surgery. After that year, we'll allow them to try to come off the medication, and if they can, great. But patients who have had a gastric bypass, it really is safer to stay on it for a long term, and there's really no downside or danger to it. One of the things I'd like our gastric bypass patients to know is after a gastric bypass, there is a small incidence, about 5 to 8%, of getting what's called a marginal ulcer. Okay? A marginal ulcer is an ulcer that develops on the small bowel side of the connection between the small bowel and the stomach. That can happen for any number of reasons. It can be a result of the surgery, from low blood flow to that area, which causes an ulcer. It can also be from using certain medications that you're really not supposed to use after the surgery, such as Advil, Motrin, Aleve, what we refer to as NSAIDs. Because all of those, including aspirin, have a tendency to erode at the lining of the stomach and the small bowel and can cause small ulcers that can lead to nausea, vomiting, bleeding, and in some cases a stricture, which is a narrowing of that opening between the small bowel and the stomach, which can prevent food from going through. The majority of the time, these are treated medically. Patients can be put on acid medication to help the ulcer heal and then avoid those medications, and it shouldn't happen again. In some cases, we need to do an endoscopy where the patient will go to sleep for a little bit. We'll look down into the pouch, and we may need to dilate that area if it's strictures. It's unusual, though, that a patient would need further surgery to take care of that, and the majority of the cases can be treated medically. But that's an important thing to know, and if you have to go on those medications for some reason, whether it's joint pain or something like that, it's very important that you're taking something like Prilosec, Pepcid, or something to control that acid in the stomach.